Hi, my name is Jessica Schultz, and this is a video with some stretches for general lower back discomfort. If anything hurts at all, stop doing that exercise. And if you have severe back discomfort and have been having it for a long time, you should check with your doctor before doing any series of stretches. So these are not Pilates exercises, these are more general stretches to alleviate discomfort. So first you'll want to think about how you're getting down to the floor. Come to seated, and then lay onto your back by first rolling to the side of your hip, and then using your hands to roll onto the side of your body, and then switch over onto your back. Start with the knees bent, about hip width apart. Then hug the right knee in towards your chest, gently pull it towards you. This should feel like a good stretch on your lower back and a little bit through the hip. If this feels okay, you can increase the stretch by straightening the bottom leg. If that creates too much of a stretch or discomfort, just bend the knee back in. We're going to hold each of these stretches for about 30 seconds. You can always go longer. Start with a smaller amount of time and then work up to a longer one if it feels okay. So to switch sides, if your non-stretching leg is straight, bend it first and then lower the right leg. Switch to the other side, hug the left knee in. And again, it should feel like a good stretch for the back and for the hip. Lower back pain can be different from side to side, so even if you straighten your leg on the first side, you may not want to straighten it on the second side. But if it feels okay, do so. And then remember to always breathe as you stretch. You're sending oxygen to your muscles, so you want to make sure that you're not holding your breath. Deep, big, full, easy breaths. And then return the bottom leg to bent, if you haven't already, and then lower the other leg. Zip your legs and feet tight together, and then take your hands, place them behind your head with the elbows wide. Start by letting the legs lower towards the floor on the left side. Make sure that both of your shoulder blades are wide on the mat, and that your feet and your knees are even together. If you're really tight, your knee may not touch the floor, and that's okay. You're not trying to force it. You should feel a stretch through the upper part of your hip. This is your TFL, and that's often very tight with lower back, possibly even QL as well. And just make sure you breathe as you stretch. The most important thing is that your knees and your feet are staying even. You don't want them to be falling apart. Just changes the stretch, and we want to really isolate it in the upper part of the pelvis. To come back through center, make sure you're using your abdominals. Pause just to make sure you're even, your feet and knees are together, and then let the legs fall to the other side. So again, you want your elbow to be touching, and you want your knees to be staying together. And again, it can be different from side to side, so don't try to match the range of motion. Just try to breathe and listen to your body and where the stretch feels best. And then same thing, using the abdominals, return the legs to center. And then we'll move on to a hamstring stretch. So bring the right knee in towards your chest, keeping it bent, and then straighten it up towards the ceiling. Don't worry about pulling the leg in too close. Your first goal is to keep your lower back long on the mat, and then your second goal is to keep the knee straight. Past that point, pull it towards you, but making sure those first two goals are met. So it would be better to have your hands lower, the leg farther away, and the knee straight, than to be hiking the hip in an effort to bringing it close in towards you. In a lot of ways, you're actively pressing away with your lower back as you stretch. So hamstrings can be very tight, and it's often very connected to lower back flexibility. So remember just to breathe and try not to force the stretch. If you have a lot of flexibility, you can straighten the bottom leg, and that will increase the stretch. So to switch sides, bend that leg that you're not stretching if it is straight, and then bend the knee in towards your chest that you are stretching, lower it to the floor. Switch to the other side, hug the knee in, straighten the leg. Again, first goal is length through the lower back. Most people have to kind of push out a little bit through their pelvis to find that. Then the straightening of the knee. And then once those two things are consistent, then bringing the leg in closer for a stretch. And then same thing here, if that feels okay, you can straighten the other leg. To release the stretch, bend your bottom knee if it's straight. Hug the leg you're stretching in towards your chest, then lower it to the floor. We're going to continue with another rotational twist in a seated position, but to safely come to seated, roll onto your side, and then use your hands to push yourself up. Straighten the left leg out in front of you. Take your right foot with the knee bent, cross it over the knee, hug your left leg around your knee, and then gently look over your right shoulder. Try to evenly keep weight in both of your sit bones, and then place the hand behind you to help lift up. Your goal here is to lift through the spine more than is to rotate through the spine and to put pressure into one side of the pelvis. So the rotation isn't coming from your lower back. Those vertebrae are pretty large and they're fused together. The rotation is actually coming from the mid part of your spine, the mid-thoracic, to help open that area up a little bit. And you might feel a stretch through the outer part of the hip or the seat if that's tight as well. And then to switch to the other side, unrotate first, uncross the right leg, cross the left foot over, hug with the right hand, and then gently look over your left shoulder. And use that hand as a kickstand again. And again, just think of growing tall. It's more important to lift in the stretch than it is to try to press over. So you're really elongating the spine as you stretch. Unrotate, come back through center. Uncross the leg. And then our final stretch, we're going to use a yoga block. There's a couple of sizes. This is the smaller size. I would pick a 2 to 3 inch yoga block as opposed to the 4 or the 6. When we slide it underneath your sacrum, that's that Y bone in the base of your pelvis, it's going to go the long way. So you have a lot of support for the lower back. Same thing to get onto your back. Roll to your side. Use your hands to lower onto your side, then come onto your back. And then start with the knees bent and the feet hip width apart. Use your seat, so you're really working in the glutes. Again, the block will go in like this underneath you, so this wide part is underneath your back, not this way. Use your glutes, lift up, slide the yoga block in, and then just release and relax onto the yoga block. So when our backs are tight, it generally pulls them out of neutral pelvis. Neutral pelvis is designed as the hip bones and the pubic bone. When they're on the same plane, that's when we're most even in our pelvic alignment. When we get tight, it tends to pull one way or the other, or it could pull from one side to the other. With the yoga block, it gives support for the pelvis without having the force of gravity on the spine to release it. I like this better than the roller because the roller is round. It's easy to sometimes arch still or hold in one part of the pelvis when you're trying to release. Like our stretches we have already done, we'll start with 30 seconds. You can always go more, start with less, and you can work up to it. And your job here is just to relax and breathe and just let the pelvis release. Then to dismount, again, make sure you're working the muscles in the seat. Take your hands, slide the block out, and then just release onto the mat. And then once you get here, it's important to stay here for another 20-30 seconds or so to help the low back release as well. So you've done the work at the roller, and now you're trying to really let the body take those changes and hold and relax through the pelvis. And then to finish and come to seated, it's the same as we've been doing, being careful for the back. Roll onto your side, hands to the floor, and then push yourself up to seated using your arms. So you could start this video once a day. If it feels good, you can take the stretches and do them longer, or you could just do the video up to 2 or 3 times a day. Thank you.